Good day to you all, our parents at homes, and our viewers, wherever you are viewing us from. Before we dive into this medical related issue, if you are viewing us for the first time, watching us for the first time, and you haven't subscribed, please click on the subscribe button. Thank you. What is cytosomiasis and how does it happen? Cytosomiasis is caused by parasitic worms, specifically from the cytosoma genus. While there are different types of cytosoma that affect the body in various ways, but today we are actually concentrating on cytosoma hematobiome, the one that primarily targets the urinary system. This parasite is transmitted when a person comes in contact with contaminated fresh water like river or lakes. The infections enters through the skin and often during activities like swimming or bathing in disinfected waters. And once this infection gets inside the skin, the parasite moves through the bloodstream and eventually settling in the bladder and ureter, causing damage to the organs and lead to hematuria, that is the blood in the urine. What are the symptoms of cytosoma hematobiome? For cytosoma hematobiome, one of the main signs is blood in the urine, especially after urination. The person may also notice painful urination, frequent urination, or even swelling in the bladder. These symptoms happen because the parasite causes inflammation and tissue damage in the urinary system. In more severe cases, if left untreated, cytosoma hematobiome can lead to complications like bladder cancer, as well as chronic pain and difficulty urinating. How is cytosomiasis transmitted? Cytosomiasis is transmitted through contaminated water. The secare, which is the larval form of the parasite, enters the body through the skin when someone is swimming or bathing in infected water. This larva then travels through the bloodstream and settles in the organs like the bladder, where they continue to mature and reproduce. Is cytosomiasis dangerous for both male and females? Yes, cytosoma hematobiome can be severe in both male and female, though the effects might differ a bit. In male, the infection can cause chronic hematuria and lead to complications like bladder damage, which increase the risk factors of bladder cancer. Infertility is also a potential outcome due to damage to the reproductive organs in male. In female, it can lead to gynecological issues, including chronic pelvic pain and even infertility due to damage to the fallopian tube or uterus. What should parents look out for? Parents, it is important to keep an eye on your child, especially if they have been in fresh water recently. And if you notice blood in their urine or painful urination or other urinary issues, make sure to seek medical attention immediately. This disease can be treated. Thank you. God bless you.